Hey everybody, it's Jessica Guglielmo, and this time our presentation is going to be going over laboratory values. Before we get started, I want to start out with this. It is okay to not know everything. Even now, I do not know every lab value or what needs to be done about it. A lot of new nurses or students get overwhelmed when looking at lab values. They have no idea what they indicate. They have no idea what they're supposed to do about it. That is okay. It's my hope that this presentation will help to alleviate some of these concerns and get you started. So what is this presentation about and what is it not about? This presentation is a quick look at the common laboratory values and interventions nurses will encounter. What it's not about is it is not a comprehensive list of laboratory values or their interventions. That would take a very long time and probably an entire course to go over. So what is a laboratory value? A laboratory value is essentially a measurable variable for a patient's body chemistry. The normal value ranges can vary depending on the hospital or institution. It's not a static range, so this is important to note. That being said, they often stay around the same range, and nurses should be able to recognize grossly abnormal laboratory values. A lab value might indicate something unusual, or it could indicate that you're having a declining patient. Let's get started with some common laboratory panels. First, the CBC, or the complete blood count. Essentially, a CBC measures types and numbers of cells in the blood. Here, you might find measurements for platelets, white blood cells, or hemoglobin levels, amongst other values. Abnormal levels here might indicate a need for a blood transfusion, assessing for bleeding, antibiotics, or whether or not you give the patient a blood thinner. Another common laboratory panel is PT, or prothrombin time. This tests how long it takes blood to clot. You'll often see this being tested in patients that are receiving blood thinners, they're bleeding, or preparing for a surgery or procedure. Another common laboratory panel that's often tested every day is the BMP, basic metabolic panel. It measures glucose, sodium, calcium, potassium, carbon dioxide, chloride, blood urea nitrogen, also known as BUN, and creatinine. This can determine blood sugar levels, electrolyte or fluid imbalances, or kidney function. If abnormal, you might need to replace electrolytes or give or withhold certain types of medications, such as insulin for high blood sugar, or withhold Lasix for a high creatinine. A similar common laboratory panel is the CMP, or Comprehensive Metabolic Panel. This includes the same things as in the BMP, plus an additional 6 tests. It is far more comprehensive focus on metabolic functions and the patient's organ systems. The next common laboratory panel is the lipid panel. This is a group of tests used to evaluate cardiac risk, such as cholesterol or triglyceride levels. Patients with hyperlipidemia might have abnormal values here. Abnormal values puts patients at a higher risk for cardiac complications, such as a myocardial infarction, heart attack, due to the increased risk of blockage to the heart. Next is the liver panel. These are tests used to assess liver function, such as ALT, AST, and bilirubin. Patients with abnormal liver values here might have assessments such as jaundiced skin or eyes, or a distended abdomen due to ascites. Next, let's touch base on TSH, or thyroid stimulating hormone. This screens for and monitors function of the thyroid. A lot of patients have hypothyroidism and receive levothyroxine in the early morning. Now on to hemoglobin A1C. This is used to diagnose and monitor diabetes. High values here can indicate a long-term problem with diabetes or uncontrolled diabetes. This is a more accurate indication of diabetes than just blood sugar checks. If elevated, beyond providing medicinal care for diabetes such as insulin, you should also prepare to provide education on diabetes. A UA, or urinalysis, is a screening to check for early signs of disease, such as kidney disease or diabetes, or urinary tract infections. If you have a UA with high levels of protein or glucose in the urine, this laboratory value can indicate kidney issues or potential diabetes onset. Let's talk a little bit about cultures. Cultures are often of the blood or the urine, but they can also be of other fluids or tissues. They are used to test for or diagnose infections such as urinary tract infections, pneumonia, strep throat, MRSA, or meningitis. Doctors often use this not only to see if there is an infection, but also to identify the specific infecting organism, to see what kind of antibiotic works best. Often, before the culture is back, can take a few days, a patient with a potential infection will be getting broad-spectrum antibiotics. If you have a positive culture, make sure to note the type of organism indicated and contact the doctor. Depending on what the patient is already taking, the doctor might initiate or change the antibiotic. Okay, we've covered some of the most common laboratory panels. Let's touch base on some interventions. Before I get started on specific interventions, I want to bring to attention two things you can always do. First, if you have a critical lab value, and a critical lab value is a grossly abnormal lab value that can have a critical effect on your patient's condition. If you have this, always notify the doctor. Next, trend. So let's say you have an abnormal or a critical lab value. Take a look at the lab values previously. Are they trending down? Are they trending up? Or were they trending a certain way and then all of a sudden now are different? Take a look at that. Now, let's try some examples of specific abnormal lab values and their interventions. Before I do get started, I want to say there are hundreds, millions of lab values and their interventions. I will not be able to cover all of them. These are just some examples of common ones. Low hemoglobin levels. Often the threshold for a critically low hemoglobin level is 7 or less. This can often indicate for most hospitals and most doctors that a patient is in need of a transfusion. So if you have a hemoglobin of 7 or less, make sure to notify the doctor. And if you don't have an order already for, let's say, a conditional blood transfusion order, then ask for it in your report to the doctor. Next, make sure that if you are transfusing and the transfusion has completed, that you have an order to recheck the hemoglobin level after the transfusion. Make sure to follow hospital protocol on how to do this. Elevated white blood cell counts. This could indicate that your patient is experiencing an infection or sepsis. First, take a look at the medications your patient is on. Sometimes certain medications can cause an elevated white blood cell count without indicating infection, such as steroids. Also, check to see if your patient is on any antibiotics. This could mean that even though they have a high white blood cell count, it's already being addressed and not something you need to notify the doctor about. Next, check the trend. Does your patient have high white blood cell count for a few days and is trending down? That's great. Or are they going up? Or was it trending down and then all of a sudden it spiked? Finally, notify the doctor. Sometimes you don't need to notify the doctor, but if you have no medicinal cause, they don't have no medications causing the white blood cell count to go up, their trend is going up despite being on antibiotics, or maybe they have a high white blood cell count but no antibiotics, these are all reasons to go ahead and notify the doctor of that white blood cell count to make sure something's being done about it. I touched base on the previous slide that a high white blood cell count could potentially indicate sepsis, and sepsis is a body's extreme response to an infection. I just want to touch base on this a little bit more as it can be a critical thing happening to your patient, and at least 1.7 million adults in the U.S. develop sepsis and around 270,000 die from it, and it is something that can be caught early and treated. So indicators for sepsis are 2 or more of the following plus a confirmed or suspected infection. If you have a patient with a temp of greater than 100.4 or less than 96.8, a respiratory rate greater than 20, heart rate greater than 100, white blood cell count, here's where that comes in, greater than 12,000 or less than 4,000, a PCO2 of less than 32, systolic blood pressure of less than 90, you have an elevated lactic lab value of greater than 2. Remember, it's 2 or more of those, plus a confirmed or suspected infection could indicate sepsis. If you have this, then make sure to notify the doctor and follow hospital protocol. Some hospitals want you to call a rapid response. Other hospitals have some form of sepsis alert. Moving on, let's go over low platelet counts. Make sure to check this before giving patients medications such as blood thinners, heparin, due to the risk for heparin-induced thrombocytopenia. Patients with low platelets counts can have a high risk for bleeding, so make sure you watch out for that. And if it's critically low, you might need to infuse platelets, so you might need to contact the doctor about that. Another lab nurses watch out for is creatinine levels and elevated creatinine levels of greater than 2. This could indicate a kidney issue. Make sure to ask yourself some of the following questions. Is this normal for the patient? A lot of dialysis patients, despite getting dialysis, are going to have high creatinine levels. Are the doctors already aware of this? Does the patient have a history of kidney issues? Some patients just naturally have a baseline of an elevated creatinine, so you might not need to do anything about it at that time. Another thing with elevated creatinine values, you want to watch out for medications. Keep an eye on the types of medications being given. Certain medications can affect kidney function, such as Lasix or certain blood pressure medications. So keep an eye on that. Low electrolytes. Nurses often monitor these to see if there's a need for replacement. And it's often on the nurses to monitor these rather than the doctors, although they should be too. These are things like potassium, magnesium, calcium, and phosphorus. If you notice some of these are low, make sure to look for protocols. Some hospitals have protocols in place that the doctors will order for that patient that can tell the nurse without contacting the doctor what and how much to give in order to replace that electrolyte. Now, notify. You have a low electrolyte. There is no protocol. Make sure to notify the doctor to get orders to replace that electrolyte. All right, that's it. As I've stated many times, definitely not a comprehensive list. However, I hope this gives you an introduction into some of the common laboratory values and examples of interventions you can implement with those laboratory values. Thank you for listening. If you have any more questions, you can contact me. Here's my email address and my phone number.